Thank you, Acting President. And I'd just like to rise to speak quite briefly on this bill. That it's a fairly varied bill, but it does deal with notifiable diseases, bloodborne diseases, but it certainly looks at other gathering of testing data, etc. So it does go to various places, and as Ms Crozier spoke about just earlier. But I think the area that I'd really like to touch on is the repeal of references to HIV and hepatitis C. And I know that there were so many people who will be incredibly grateful about this amendment to this piece of legislation. This just takes us another step towards removing the stigma and discrimination of people who have HIV and Hep C. And it's a stigma that can be fatal. You know, it's a stigma that sometimes means people don't seek the help that they need. They get ostracised from their families. We see people with HIV, particularly in the earlier days, they weren't dying from HIV, they were dying from suicide. And they were dying because of the stigma and the discrimination and the shame imposed upon them for contracting HIV. So this is a good development. This is a very positive part of this legislation. And as I say, there's been numerous things numerous areas and numerous changes to legislation over the last two terms that the government has put forward that goes, more and more towards removing that stigma around HIV. And I'm grateful for it. And on behalf of the HIV positive community, they express their thanks for this, because HIV now is treated much like diabetes. It's something you'll have for the rest of your life, but it's not what's going to kill you. You are not going to die from it. And in fact, for most people who are taking the medication as prescribed, they will not even test positive. They will have such a low viral load that it just will not even show up in a test. So, and it would be next to impossible to transmit HIV when you're taking the medication as we are now. We also have things like PEP and PrEP, so which are other preventative tools that we have to stop people from contracting it in the first place, or if they feel they've been exposed, having the tools to help them not see HIV actually, for them to fully contract HIV. So this is a really welcome amendment, and I have to say, I've been involved around HIV since the late 80s. And I don't think any of us thought in the late 80s we would be talking about HIV in the way that we're talking about it today, that we would be talking about that HIV not actually being transmissible. And that people living full lives, never going from HIV to AIDS. Now, that's in this country, and we are one lucky country for that. Many other countries are still struggling with this, and we've still got a long way to go globally. But here in Australia, we have done a remarkable job to fight HIV. And I think that I'd just like to comment quickly, given Ms Crozier's comments around testing and sex workers. Now, sex workers were the first cohort of people to be cognisant of the risk of HIV. Long before the community was aware of it, we saw the sex worker community become very aware of it and very concerned about it. And we saw almost 100% of sex workers using safe sex practices, as I say, back as far as 1987, 1988 in Australia, the Australian sex workers were right at the front of this from prevention. And also looking after their own health through sexual health testing, as they will continue to do under a decriminalised model. Sex workers will continue to look after their health. And I think it also should be noted that there has never, ever been a transmission of HIV from a sex worker to a client, ever in Australia. Not one single reported case of a sex worker transmitting HIV to a client or during their work. So it's a concern. It is an unnecessary concern, and it goes, I think, very much to the judgment and stigma that people place on sex workers, that somehow sex workers can't be trusted even with their own health, and that somehow the government must control them because these are, and most sex workers are female, that these women are fallen, and that there is a considerable amount of moral judgment placed on them in this regard. So there's nothing to be afraid of. We've spoken, when you speak to all of transmissible disease experts, from Burnett even to the Melbourne Sexual Health Centre, were saying it was the 3-monthly compulsory testing was unnecessary, expensive, and sex workers were seeking to look after their own health. They did not need legislation to do that. So on that, the other point I'd just like to touch on, because I'm sure Ms Ratnam will be speaking soon. She is putting up amendments in relation to drug checking and drug notifications. And as many of you would be aware, she and I have jointly sponsored a bill on pill testing, and that sits on the notice paper, and it may be something that we debate before the end of this term. But what we're seeing, there's a growing amount of evidence, not just international evidence, where pill testing has been undertaken and has been regular practice for many years, even decades. But even within Australia, the ACT has been conducting and supporting pill testing for a number of years now. In fact, there will be a festival in the ACT next month where there will be a pill testing facility established there. You know, the concept of pill testing is supported by the Australian Medical Association, the Royal College of General Practitioners, the Royal College of Physicians, and just about every single alcohol and other drug expert and person who works in that field. So we are going to be seeing festivals come back, thankfully, and I'm sure we're all very happy to see that the festival season will hopefully be almost as normal as possible coming the end of this year. And what we see from pill testing is it's almost a loss leader. So you get, and I've witnessed this not just in Australia but also overseas, where you'll have someone coming in, bringing in their pill to be tested. Now, the machine that goes ping does the testing, lets them know what's in that substance, and we know that, you know, if that substance is not found to be what that person thought it was, or is found to be something dangerous, guess what? That person does not consume that substance, and that substance is disposed of. But most importantly, as part of that process, they get to speak to a health practitioner. And that health practitioner, and it's phenomenal, you can't get some of the young people out of the tent because they have so many questions around drug use. They have so many questions about the interactions between various drugs, whether that's prescription medication and more recreational drugs, as it were. And it's that education that happens at that point, and we know that it prevents deaths. It is a very sensible approach. Now, in Dr. Ratnam's amendments, there's also an amendment where if a bad batch of drugs is found in our community, then this would require the police to report on that. Now, we saw this in Chapel Street. Where a number of people died unnecessarily because we didn't get out there on the radio and tell people. We didn't get out there on the social medias to warn people about a very bad batch of N-bone, which was being sold as MDMA, and we saw people die as a result. Now, contrast that to about 6 years ago in the Netherlands, where there was a similar deadly batch of illicit substances going around. Now, they have an early warning system. So, of course, it went out on the news. It went out on all of the social media networks, and that prevented possibly hundreds of injuries, if not deaths. And we could and we should be doing that in Australia. It makes absolutely no sense that we're not doing it. So this is really about, this is harm reduction. And I think when I've listened to debates over the last 7 years, no one seems to oppose harm reduction, except when it comes to illicit drug use. Then it's just this proposal, and it's a preposterous proposal, that we just tell people to say no, that all drugs are dangerous and so you must just say no. It's not happening. And it doesn't matter how many penalties you put around drug use. The numbers of people who are using drugs does not decline. What does decline is the safety. What does decline is the ability for that person to seek help. So I think largely this bill is uncontroversial and welcome in regards to HIV and hepatitis C. But I certainly I welcome Dr. Ratnam's amendments to this bill, and I commend the bill.